Featuring in this video is to learn what to expect and the things that you need to know when you get total knee arthroplasty or total knee replacement. So what is total knee replacement? It is basically a surgical procedure wherein the diseased knee joint is being replaced by artificial materials. There are reasons why people get total knee replacement. And the most common of it is severe arthritis of the knee that may give you excruciating pain even when you're at rest. It may cause you knee joint destruction and knee deformity, causing you to have restrictions when you're doing activities using your knee. Some exercises that are difficult and unable to do for the person who decided to get the total knee replacement includes walking without a limp, difficulty kneeling, difficulty climbing stairs or unable to do, bending the knee, squatting, sit to stand and going back to sit, and of course, playing sports. Your doctor will explain about the surgery, possible complications, time frame for healing, and answers any question that bothers you. Examples of the risks and complications that the doctor will discuss with you are pain and stiffness, urinary tract infection, nausea and vomiting, bleeding into the joint, infection, nerve damage, deep vein thrombosis, or blood clot. After the total knee replacement surgery, expect that you will be up and moving as soon as possible. This is very important in order to decrease the risk of complications such as deep vein thrombosis or blood clotting, joint stiffness, and excessive scarring on the incision. Contrary to what people thought, that resting is instructed after the surgery, it is actually ideal that you can walk using a walker or a crutch to go to the bathroom day 1 after your surgery. During your stay at the hospital, you will be visited by a physical therapist to teach you the proper use of the crutches or the walker, depending on the weight-bearing instructions from your doctor or your surgeon. Your therapist will also let you use only a cane if you can tolerate it, but if it's too much of a pain that you are experiencing, then you will be taught by the therapist how to use the wheelchair. Some of the weight-bearing instructions that may be instructed for you would be non-weight-bearing, toe-touch weight-bearing, partial weight-bearing, and full weight-bearing. Now, partial weight-bearing can be 25%, 50%, 75%. And what are these percentages stands for? These are percentage of your body weight. So how do you gauge the weight-bearing instructions objectively after you get the value of your percentage of your body weight? You can gauge it by using the weighing scale. For example, if you weigh 150 pounds, 25% of it is 37.5. So step down your affected leg onto the scale until the value indicates 37.5 pounds. Then remember how your leg feels while you push it on the scale, because that's how much weight you put as well when your affected leg is on the ground. Let's do how to walk with a crutch or a walker. This will be taught to you by your physical therapist. Place the walker or crutch forward. Then push yourself up with both hands and swing forward the affected leg and touch the ground following weight-bearing instructions. Now you can control the weight bearing of the affected leg with the push of your hands on the hand grip. Next is how to walk with a cane as well. Let's say, for example, the bad leg is the left side, and then the good leg is on the right side. Now hold the cane to the good leg. Place cane forward, approximately 2 inches to the side and 6 inches out to the front. Then step with the bad leg forward, and then followed with stepping with the good leg. There are proper adjustments with the crutches. It is very ideal that you will have at least 3 fingers distance between the axilla and the auxiliary bar. There should be at least 30 degrees elbow bent when your hand is on the hand grip of the crutch. But if your hand is off the hand grip, make sure that the hand grip is at the wrist level when your hand is on the side of your body. Put the crutch tips about 2 inches to the side, then 6 inches out to the front as well. There are proper adjustments too for using the walker and the cane. 30 degrees elbow bend should be there when your hand is on the hand grip. And if your hand is not on the hand grip, make sure that the hand grip is at the wrist level when the hand is on the side of the body. There are some precautions that you do observe when you're using the crutch. Do not lean on the auxiliary bar, because you may compress very important nerves that puts your arm to sleep and you lose grip of the crutch. Another precaution in using the crutch, please do not slouch, because you may experience shoulder and back pain. Now, do push yourself up by pushing on the hand grip. While you're then the hospital physical therapist may ask you to climb the stairs by using the crutch, cane, or holding onto the railings. The standard instruction would be you go up with a good leg and down with the bad leg. So there are some normal symptoms that you feel after getting total knee replacement. First off would be pain, of course. Then expect there will be swelling, some skin bruising or skin discoloration. Your knee will be sensitive to touch, and it's also going to be stiff. And of course, there will be unexpected muscle guarding as well. Now, while you're in the hospital or at home, your occupational therapist or nurse will teach you how to use the toilet or to go in and out of the tub when you're showering. Or simply, they will teach you how to do sponge bath. The nurse will also instruct you how to change dressings and how to do it properly as well. And the OT or nurse may also teach you how to do upper and lower dressing if there's a need to do so. Well, the physical therapist will be there to teach you some exercises, like kitchen sink exercises, home exercises program, some bed exercises, and exercises while you are sitting as well. Now, some of the physical therapy goals for early exercises is to keep your knee as straight as possible to prevent tightness and start bending it as well as tolerated. You respect incision or surgical site with education regarding time frame for healing. And make sure that the exercise will prevent blood clotting, and make sure that the scar is as mobile as possible as well to promote good circulation and fast healing. Now, the physical therapist might also teach you proper breathing exercises. Now, you breathe in through the nose for about 4 seconds. As you breathe in, your chest will rise, your diaphragm goes down as your abdominal goes forward. And then you breathe out through your mouth for about 4 seconds as well. Other physical therapy treatments include modalities such as ice and tense unit, stretching like hamstring stretch, and also exercising other muscles that is acting upon the knee. Before you go out of the hospital, your doctor will give you some instructions about your medications, the follow-up checkup as well, or if you will be referred to outpatient physical therapy or home health physical therapy. Your doctor will also give you some warning signs of infection. If there's increased warmth on the incision site, abnormal redness, if there is unusual pain, swelling that doesn't seem to subside, and pus formation. So it's very important that you're going to inform your doctors and dentists if you get invasive surgery, dental or gum procedures, urological and endoscopical procedures, because you will be at high risk of infection. And so that's all for the lesson today. And please do like and subscribe if you love this channel. And thank you very much for watching.